क्या आप जानते हैं एक ऐसा विरुस है जो चुपके से हमारी सेहत पर हमला करता है? ये विरुस अक्सर लोगों को बीमार कर देता है बिना किसी को पता चले। इट्स कॉल्ड HMPV और ह्यूमन मेटाप्न्यूमोविरस। ये वायरस पहली बार 2001 में पाया गया था। साइंटिस्ट डिस्कवर्ड इट इन 2001। तब से इस पर कई रिसर्च हुई है और ह्यूमन इसके बारे में बहुत कुछ पता चला है। Before that, many cases of respiratory illness went undiagnosed. लोगों को लगता था कि यह बस एक आम सर्दी या फ्लू है। HMPV is a respiratory virus, much like the flu or the common cold. ये वायरस हमारे श्वसन तंत्र को नुकसान पहुंचाता है। It spreads easily from person to person. ये वायरस एक व्यक्ति से दूसरे व्यक्ति तक आसानी से फैल सकता है। This happens through coughing, sneezing or even talking. जब कोई व्यक्ति खसता या छींकता है, तो ये वायरस हवा में फैल जाता है। The virus can linger on surfaces too. ये वायरस अलग अलग सतहों पर भी कुछ समय तक जिंदा रह सकता है। Touching an infected surface and then touching your face can transmit the virus. इसलिए हाथ धोना और सैनिटाइजेशन बहुत जरूरी है। That's why understanding HMPV is so important. ह्यूमन इस वायरस के बारे में जानकारी रखनी चाहिए ताकि हम अपने आप को सुरक्षित रख सकें। We must know how to protect ourselves and our loved ones. मास्क पहना, हाथ धोना और सोशल डिस्टेंसिंग से हम इस वायरस से बच सकते हैं। So let's delve deeper into the world of HMPV. आइए इस वायरस के बारे में और जानें और समझें कि ये कैसे काम करता है। Let's understand its impact and learn how we can fight back. हम सब मिलकर इस वायरस का सामना कर सकते हैं और अपने परिवार को सुरक्षित रख सकते हैं। HMPV can infect anyone. However, certain groups are more vulnerable to severe illness. Children, especially infants, are particularly susceptible. Their immune systems are still developing. Elderly individuals are also at a higher risk. As we age, our immune system weakens, making us more prone to infections. People with weakened immune systems are also vulnerable. This includes individuals undergoing chemotherapy or those with chronic illnesses like HIV/AIDS. For these individuals, HMPV infection can lead to serious complications. These include pneumonia, bronchiolitis, and even respiratory failure. Therefore, it's crucial to be extra cautious and take preventive measures. HMPV, or human metapneumovirus, often begins with mild, cold-like symptoms. These initial symptoms can be quite similar to those of a common cold, making it difficult to distinguish without proper medical testing. These include a runny nose, persistent cough, and a sore throat. The symptoms can vary in intensity from person to person. Some people may also experience additional symptoms such as fever, headache, and muscle aches. These symptoms can sometimes be mistaken for other respiratory illnesses like the flu. In young children, the symptoms can be more severe and may require closer monitoring. Children under the age of 5 are particularly vulnerable. They may have difficulty breathing, wheezing, or a rapid breathing rate. These respiratory issues can escalate quickly, leading to more serious conditions like bronchiolitis or pneumonia. If you notice these symptoms in your child, seek medical attention immediately. Early intervention can make a significant difference in the outcome. HMPV spreads primarily through respiratory droplets. These droplets are expelled when an infected person coughs, sneezes, or even talks. When an infected person coughs or sneezes, these droplets can travel up to 6 feet. This makes close contact with an infected person particularly risky. If these droplets land on your nose or mouth, you can become infected. It's important to avoid touching your face, especially your nose and mouth, to reduce the risk of infection. The virus can also spread through direct contact with contaminated surfaces. This includes everyday objects like doorknobs, handrails, and even toys. This includes touching an infected surface and then touching your face. Regularly cleaning and disinfecting commonly touched surfaces can help prevent the spread. Therefore, maintaining good hygiene is crucial in preventing the spread of HMPV. Washing your hands frequently with soap and water, using hand sanitizer, and practicing good respiratory hygiene can significantly reduce your risk of infection. The symptoms of HMPV can be very similar to those of other respiratory illnesses. This includes the flu and COVID-19. This often leads to misdiagnosis. Like HMPV, the flu and COVID-19 are also highly contagious respiratory illnesses. They share similar symptoms, making it difficult to differentiate them based on symptoms alone. This overlap puts additional pressure on healthcare systems, especially during peak seasons. Accurate diagnosis is crucial for appropriate treatment and to prevent the spread of these viruses. Therefore, it's essential to consult a doctor for proper diagnosis. They can conduct tests to determine the specific virus causing your illness. Section 5. The Quest for a Shield. Vaccine Research and Development. Currently, there is no specific vaccine available for Hmpv. This virus, which can cause severe respiratory infections, particularly in young children and the elderly, remains a significant challenge for the medical community. However, research is ongoing to develop an effective vaccine. Scientists around the world are dedicating countless hours in laboratories, working with advanced technology and innovative methods to find a solution. Scientists are working tirelessly to understand the virus better and find ways to combat it. They are studying the virus's structure, its modes of transmission, and how it interacts with the human immune system. They are exploring various approaches, including developing vaccines that target specific proteins of the virus. By focusing on these proteins, researchers hope to create a vaccine that can effectively neutralize the virus and prevent infection. While a vaccine is not yet available, there is hope on the horizon. The progress made so far is promising, and each day brings us closer to a potential breakthrough. The ongoing research offers a ray of hope for a future where we have a shield against this potent virus. The dedication and perseverance of the scientific community are our best weapons in this fight. Until then, we must rely on preventive measures and early detection to minimize the impact of Hmpv. Simple actions like wearing masks, practicing good hygiene, and staying informed about the latest health guidelines can make a significant difference in protecting ourselves and our communities. Section 6. Our first line of defense. The power of hygiene. While we await a vaccine, simple hygiene practices remain our most effective weapons against Hmpv. These practices can significantly reduce the risk of infection. Washing your hands frequently with soap and water is crucial. Wash your hands for at least 20 seconds, especially after coughing, sneezing, or blowing your nose. If soap and water are not readily available, use an alcohol-based hand sanitizer. Choose a sanitizer that contains at least 60% alcohol. Cover your mouth and nose with a tissue or your elbow when you cough or sneeze. This helps prevent the spread of respiratory droplets. Section 7. Knowledge is power. Spreading awareness. Preventing spread. Education and awareness are vital in the fight against Hmpv. By understanding the virus and how it spreads, we can take proactive steps to protect ourselves and others. Parents, teachers, and healthcare providers play a crucial role in spreading awareness. They can educate children and families about Hmpv, its symptoms, and prevention strategies. Public health campaigns and community outreach programs can also raise awareness about the virus. These initiatives can provide valuable information and resources to the public. Remember, knowledge is power. By arming ourselves with information, we can make informed decisions and stay one step ahead of Hmpv. Section 8. Staying ahead of the curve. Proactive measures for a healthier future. Prevention is always better than cure. By adopting proactive measures, we can minimize the risk of Hmpv infection and protect our communities. Avoid close contact with sick individuals. If you are sick, stay home to prevent spreading the virus to others. Clean and disinfect frequently touched surfaces regularly. This includes doorknobs, countertops, and toys. Maintain a healthy lifestyle by eating a balanced diet, exercising regularly, and getting enough sleep. This helps boost your immune system and makes you less susceptible to infections. Section 9. United we stand a call to action. The fight against Hmpv is a collective effort. We must all play our part in preventing the spread of this virus and protecting vulnerable populations. Stay informed about Hmpv and share your knowledge with others. Encourage your friends and family to adopt preventive measures. Support ongoing research efforts to develop a vaccine and better treatment options. Together, we can make a difference. Let's join hands and create a healthier future for ourselves and generations to come. Remember, every step we take brings us closer to a world free from the threat of Hmpv.